Hey guys, it's Dr. Workman with Traditional American Medicine. Today I'm going to show you a little bit about what osteopathic manipulation treatment will look like if you're a patient in our office. OMT, as we shorten it, is something that we use to find areas of pain, somatic dysfunction, as we call it in the body, and we're going to try and realign your body and help it heal itself. That's my main goal here. Dr. Sample has volunteered to be my patient today. So I'm just going to kind of run through what an exam would look like for him and maybe a couple treatments just so you kind of get a feel for what that looks like. And I'll talk to you a little bit about what I'm doing along the way, just so if you come in for OMT, you know what you're getting yourself into. All right, so I'm going to go ahead and take your glasses, if that's okay.
There you go.
Thank you. And I'm going to have you go ahead and move all the way down here to the edge for me. So I'm going to look at Dr. Sample's back. I'm just kind of going to look for a couple areas and see if there's anything that's out of alignment.
Ooh.
That one's tender. So he's a little bit rotated in this region. So what I'm going to do is I'm going to treat that area. I'm not putting you in a headlock, but I am going to reach around your shoulders. Is that okay? All right. So. All right. That one actually articulated. All right.
Yeah,
little pop with that one. So sometimes we try and pop things and some things pop on their own because they want to move. Okay. The rest of you feels pretty good. So what I'm going to have you do is lay down for me on your back with your head up here.
I've been waiting for this.
All right. So I'm going to check his occipital region. So right at the base of his skull where his neck meets his head. And I'm going to try and soften that area up a little bit. This area can be a big problem area for a lot of people. It can cause headaches in people. It can cause a lot of neck pain. I'm also going to take your bandana, your trademark bandana, out of the way here.
Take good care of him.
I promise to give it back. No one will recognize Dr. Sample if we take away his bandana.
Got the Superman Clark Kent thing going on.
Yeah.
Just disappear.
All right. All right. So soften that area up. I'm going to check his neck. Dr. Sample treats his own neck, so he doesn't really have a ton of areas where I can focus on today. That's all right. I can also check his fascial plane. So OMT is not just about muscles and bones. Sometimes it's about loosening up areas of what we call fascia to help the lymphatic system, where your white blood cells go. It helps with immunity. When you have a sinus infection, you definitely want that to be loose so everything can drain out of your head to the rest of your body. So I just want to keep that nice and loose so your lymphatic system can work properly. That's nice and loosened up for you here. If you're someone coming in with a sinus infection, that could be a whole nother video, but we'll make sure we talk about that another day. Right now, I'm just going to keep moving down. So I've looked at Dr. Sample's back. I've looked at his neck. I've looked at his head. I'm going to move down to his hips. So what I'm going to have you do is do what we call a hip flop for me, or reset your pelvis. So put your knees up, butt up, back down, slide your legs out, and then I'm going to use my hands to check his hips.
This has been out for a while.
Yeah. I've been slacking on treating Dr. Sample at home, apparently. All right, so I can tell that his hips are out of alignment by about this much. That's pretty common. If I tell you that in the office, don't panic. And what I'm going to do is I'm going to use his feet to help me reset that. I'm going to check, and yep, seems to be the case. So his ankles are also telling the similar story. I treat both legs because I believe that one leg is probably the problem and the other side is probably compensating. All right. So go ahead and do a hip flop for me again, Dr. Sample. Thank you. Perfect. Okay, so that little movement right there reset his hips. Now what I'm going to have you do is go ahead and bend your knees for me. Sure. So most likely he has some other dysfunction in his pelvis. This is a good catch-all to reset that area. So I'm going to have you push out against me. 1, 2, 3. And relax. Go ahead and push again. 1, 2, 3. All right. Then you push in. 1, 2, 3. One more time. 1, 2, 3. All right, little pop at the end, just for good measure. I'll warn you about that. I don't warn him. Go ahead and roll onto your belly for me.
Sure.
He knows what's coming for most of this, so it's kind of cheating. I'll go ahead and put your bandana over here. Safekeeping.
Like I said, I've been waiting for it.
So I'm just going to evaluate his spine one more time. And for the most part, I don't feel any rotations, but I am going to stretch it out. And basically the big muscles that run down your spine, all the way down, your spinal column on either side, those are your paraspinal muscles. And those can get really, really tight for a lot of reasons, mostly our posture. But also if there's any other dysfunctions going on, they tend to pull at those muscles. So I like to stretch them out both from that direction, a little bit from this direction, and then side to side. Fun fact, I believe it was Dr. Sample who actually showed me when we were in residency training that stretching the muscles from head to toe direction helps as well, because in my training I just learned side to side stretching, which I'm going to demonstrate in a second. This is what I learned. It's just as effective, but if you pair the two together, chef's kiss. And I'm just working on my way down, stretching those muscles, because it's hard to stretch them on your own, and making sure I get them to soften up a little bit. That allows your back, your spine to hold its neutral rotation well. It's not going to hold that dysfunction that was there previously as easy if your muscles are stretched out. For the lower parts, sometimes I'll kind of add a little bit of having my patient help. So go and push your hip into the table. Great. And push. Wonderful. Okay. I'm not going to do the other side because then my back's to the camera. No one can see me. The next thing I'm going to do is I'm going to check Dr. Sample's sacrum. So I'm going to do that. That's the area where your spine meets your tailbone, so to speak. So I'm just going to put my hands on that area and take a deep breath in for me. And out, and in, and out. Good. And just keep doing deep breaths for me. Perfect. So I'm going to rock on that sacrum a little bit. Good. All right. I'm going to check for levelness. Okay, his is a little bit uneven, so I'm going to reset that for him. So what I'm going to do is have you bend your knees upward for me. All right, you're going to push in against my arms and give me a big cough. One more time. Perfect. Go ahead and put your legs back down. We're just going to check one more time here. Great, that's more level. And then I like to teach my patients how to get up from OMT. This is how I recommend everybody gets up out of bed, just because it saves your back and your neck muscles a little bit of strain. So go ahead and roll up onto your side for me, Dr. Sample. And then I want you to swing your legs around and use your arms to push yourself up. Perfect. And he has a nice, lovely ring around his face from the table, just like I planned for the camera. So, yeah, so that's a little bit of a demonstration for OMT. I promised I'd give him back his bandana so you can recognize who he is. I'll even give him his glasses because I'm feeling generous today. But yeah, that's what OMT looks like. Obviously, for each person, it's different. You treat what you find. I'm not going to do the same thing for every person. But the goal is to get you back in alignment and to help the body start to heal itself. Your body is a beautiful machine. That is what it is made to do. And our job is just to help it along the way.
And even though some of this was demonstrational,
yeah,
the sacrum, that always helps. Yeah. That's the thing that a lot of people forget. Sometimes you get chiropractors and even fellow DOs where they try to fix everything else, but they don't fix the sacrum, or they don't fix the pubic symphysis. And when those get overlooked, your hips are going out. That's going to lead to back pain. It's going to lead to hip pain, knee pain, all over. Yeah. And so even though it was a demonstration, always feel great when it's done.
He's saying I helped. But the important thing, like he's saying, is your body is a unit. That's one of our, what we call osteopathic tenets. So it's one of the rules that we follow, so to speak. Your body wants to be in alignment. We are trying to line it up. But if you miss key lesions or key regions, then your body is just going to fall back into that same bad habit, so to speak. So we want to line you back up. We want to help your body be set up for the greatest success that it can. And we hope you enjoyed this demonstration. Please feel free to reach out with questions. Check out our website, www.traditionalamericanmedicine.com, and you can see how to schedule a pre-enrollment interview if you're interested. Our patients who are members of Traditional American Medicine, they get OMT unlimited visits included as part of their membership. There's not any extra cost. That's just part of your membership, which we think is a huge addition, not just for people with aches and pains, but for your overall health, it can be beneficial. So yeah, check out our website, see how to schedule a pre-enrollment interview, ask us more questions.
We also have pregnant women.
Oh yeah. So you can talk a little bit about that if you
Sure.
want.
So we have a deal. So and if you don't want to pay per visit, because when you're pregnant, a lot of your muscles and ligaments get loose, and so you end up having a lot more pelvic and low back pain. And so what we decided to do was create a special membership where if you don't want to join the practice, but you still want OMT done, for $75 a month, if you're pregnant, you can get unlimited OMT visits. We're talking you come in because you have back pain in the morning, and if that slips out again that afternoon, you come right on back. There's no additional fee. It's $75 flat. Whitney's had 2 kids, and so I've had to do a ton of OMT on her, and it didn't seem right to be charging pregnant women per visit since they are prone to having things go out. So $75, unlimited during pregnancy, and then also 2 additional months after as your body's healing itself. So we're happy to be able to offer that because we went through it and we don't want other people to
I don't know what I would have done without it. Honestly, it was a huge benefit to me during pregnancy, and we want to be able to share that, like you said, with other pregnant individuals. So that's if you're a pregnant person, $75 a month. If you want to be a full member, we'll take care of your family medicine care and OMT. That's $100 a month for adults and $25 a month for kids. If you just are looking for someone to do OMT and you're not a pregnant person, then we can talk about that too. So if you just want OMT and you're not a pregnant individual, the first visit is $50 and then $35 for any follow-up visits. And that is as many times as you need to come in. You just schedule an appointment and then we'll charge you per visit for that. But like I said, if you're a full member, it's included. So you don't have to have that extra cost per visit. So we hope this was beneficial. Please check out our website. Like I said, www.traditionalamericanmedicine.com. And we hope to see you then.